Welcome to the fourth part of this series where we'll be talking about the United Nations high-level meeting happening in 2025 and what are some of the key commitments that the World Heart Federation, in collaboration with global health experts on cardiovascular health, are proposing to this gathering in 2025 on the improvement of focus and attention on cardiovascular health as part of the broader non-communicable diseases agenda. My name is Ogweno Stephen. Let's roll. The next key focus that the World Heart Federation has presented for the United Nations high-level meeting 2025 on non-communicable diseases is prioritizing implementation. The World Heart Federation has really come out strongly to remind and encourage that as part of the broader adoption of policies, strategies, and plans in the United Nations high-level meeting is to prioritize implementation on actions that will be adopted, and especially also actions on cardiovascular health as part of the broader NCDs agenda. This priority on implementation is a huge focus because one of the biggest failures that we've had, if we are going to look at the Sustainable Development Goals, despite the implementation of very impressive policies and plans, is a slowdown and a letdown in the implementation of these policies. Globally, we have seen a significant plan on addressing these non-communicable diseases. However, on the flip side, we've seen a reduction in the focus and priority on implementation. And this is one of the key focus areas that the World Heart Federation is proposing to the United Nations high-level meeting. Why is implementation a priority, and why has it not been implemented as best as we can? In the past, we have seen impressive policies on universal health coverage, on improvement of health systems. However, without political commitment, without heads of states, without presidents, without heads of states agreeing and committing to implement these policies, then they remain to be suggestions. And as a result, the communities that would have benefited from the implementation of these policies do not benefit. In order to improve these systems, the universal health coverage, the health systems that have been developed, impressive policies that are on paper, they require political commitment. And this can be enabled by the following: sustainable funding. A lot of these commitments that have been made without sustainable funding never get to be implemented. And so we are asking the United Nations high-level meeting to politically commit on this and then provide mechanisms for sustainable funding for the global and also for the national plans on cardiovascular health. The next one is strengthen healthcare systems and strengthen healthcare workforce. The strengthened healthcare workforce and the strengthened healthcare systems ensure that work on non-communicable diseases and on cardiovascular health reach people in the community. Also, strengthen primary healthcare, focusing on prevention, focusing on development of healthy behavior, focusing on elimination of these diseases and their risk factors is a big part of this commitment, ensuring that individuals in the communities can be able to prevent these diseases and that the primary health systems support these prevention efforts and encourage these prevention efforts as well. Certainly, we also see strengthened institutions as a way to really improve this commitment, and also we're looking at research and the ability to generate new evidence that supports what are better ways to implement these policies, to implement these systems that would have the biggest impact in the communities that we work with. Finally, looking at the mechanisms of cross-sector implementation, because we in health recognize that we cannot do it alone. We recognize that health is a broad topic that cannot only be solved in the health system. And this is why we are also calling for policies that are harmonized across the different sectors. Policies adopted in health should work across policies adopted in the food industry, across policies adopted in the built environment, amongst other health issues, to ensure that there is a harmonized environment and that all policies are working together to improve the health and wellness of their communities. Again, this is some of the key focus areas when you're looking at the prioritization of implementation as one of the key asks that the World Heart Federation, in collaboration with patients, in collaboration with experts on cardiovascular health, are proposing at the 4th United Nations High-Level Meeting in 2025. And with this, see you on the next episode where we'll be talking about the last focus priority area which the World Heart Federation is proposing to the United Nations High-Level Meeting for adoption as part of the broader implementation and strategy on addressing the rising burden of non-communicable diseases. See you on the next one.